I'm Bruno Paiva from the University of Navarra in Pamplona, Spain. I think there is currently great interest to understand if mass spectrometry can replace immunofixation at diagnosis as well as during treatment or after treatment to assess depth of response in patients with multiple myeloma. I think that at diagnosis, there is now a great body of evidence showing the power of mass spectrometry as an excellent screening tool in the field of monoclonal gammopathies. I think it is a very sensitive and specific method that yields all relevant information and beyond, such as, for example, if the immunoglobulin is glycosylated and how this relates with the risk of progression, for example, into light chain amyloidosis, which is of tremendous importance. Therefore, it seems very appealing and interesting to use mass spectrometry at diagnosis, not only to replace immunofixation, but perhaps even to replace all serological methods. And I think this is particularly attractive in those centers with large volume of serum and urine samples to screen for patients with monoclonal gammopathies. Regarding assessment of depth of response, I think that there is less data when compared to diagnosis, but the data that is out there, and I'm confident that much more will come in the next few months, looks very, very promising. It appears that indeed mass spectrometry, and within mass spectrometry, some singular approaches can be high sensitive and particularly more sensitive than immunofixation. And I think this is very interesting since we knew already for many years that current biomarkers that define complete remission, one of them is immunofixation, perhaps lacks sensitivity, taking in consideration the quality of complete remissions that is now achieved with current treatment strategies. Furthermore, mass spectrometry, by its nature and the way the methodology works, is attractive not only because of sensitivity and specificity, but also because it resolves potential interference of monoclonal antibodies which patients may be on treatment. Then I think the final question, and this is where, in my opinion, we still need clearly more data, is to understand the complementarity between immunofixation, mass spectrometry, cellular methods to assess low levels of disease or MRD, such as flow and sequencing, as well as imaging methods such as PET-CT. I think that, as always, there will be room for complementarity. I think that synergy across all these methods will play out as optimal ways to monitor treatment efficacy and identify patients with excellent outcome. I think it is also reasonable to accept that there will be some level of discordance across all these methodologies because they are measuring different elements, different features of tumor biology. I think this should not be seen as a drawback, rather an opportunity to rely on all these methods and identify patients with double or triple negative MRD. These are the ones that in principle should have the better progression-free and overall survival, and potentially a double or triple negative MRD result should be the new endpoint of myeloma therapy for the next few years.